Welcome to the Maternity Mentor. Today we will be talking about some of the 10 signs you can look for to know you're in labor. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC. I am maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Knowing you're in labor can be stressful and confusing. Whether it's your first baby or your seventh baby, the start of labor can look different from woman to woman and pregnancy to pregnancy. Let's explore the 10 signs of labor so you can know what to look for. A lot of women hear about the baby dropping, but what does that really mean? Dropping is also called lightening or engagement. This is when the baby's head lowers or descends into the pelvis. This can happen anywhere from 1 hour to 1 month before true labor. It's considered a pre-labor sign. When the baby drops, you may feel like it's easier to breathe because the baby is no longer pressing on the lungs. Your heartburn may disappear also. However, you may start to waddle due to the lowered position of the baby's head. This may also cause you to go to the bathroom more often due to pressure in your pelvis. For first-time mothers, this tends to happen 2 to 4 weeks prior to labor and varies from woman to woman. For women having additional babies, this usually does not happen until true labor has started. When you are pregnant, you have an increase in a hormone called relaxin. This makes your ligaments loosen up. This can cause you to be clumsier, especially towards the end of your pregnancy. Therefore, women who are pregnant are at higher risk for falls. Anywhere from 1 hour to 4 weeks before birth, you may start to notice that you feel even looser than you did before. This assists your pelvis in opening to make room for your baby during delivery. The nice part about this phenomenon is it can make your whole body feel more relaxed. This leads us to our next sign, which is that weight gain stops. It is normal in the final 4 weeks before delivery for a woman to gain 1 pound per week. However, this weight gain can stop, or women can even lose weight in the few days before delivery. This is a normal phenomenon. It does not affect the baby's weight or health. The weight loss could be caused by a reduction in amniotic fluid or increased activity that many moms will experience as they prepare for the new baby. The nesting instinct is a sudden burst of energy women get at the end of the 3rd trimester. The nesting instinct causes an overwhelming urge to organize and clean the house to help get ready for the baby. It can occur anywhere from 1 hour to 1 month before active labor begins. Mothers may cook extra meals or get the baby's room ready. It's important to remember to rest even though you have extra energy. You need to get plenty of rest. Some women can also have the opposite feeling. Many women in the final stretch will feel excessive fatigue. If this happens to you, rest as much as possible. You need to conserve your energy for labor and delivery. Before we continue, please remember to hit that like button and subscribe so we can continue to create this content. Now, let's talk about the next sign, which is increased back pain and cramping. Your muscles will start stretching and shifting to prepare for birth. This may cause some pain in your lower back or groin. You may also feel crampiness. If this is not a woman's first pregnancy, she is more likely to experience this phenomenon. This pain does not change with position or movement. Some people may also perceive this as pressure. This is a sign that active labor is near. The next sign that can occur anywhere from 1 hour to 1 month before labor is diarrhea. Muscles in the uterus and joints relax due to relaxin. This can also cause the rectum to relax. This can lead to diarrhea. It is extremely important that you stay hydrated if you are experiencing this. You may also experience some nausea and vomiting. In the last month of pregnancy, your cervix will start to make changes in preparation for birth. The changes are more significant when it's not your first baby. The first change is dilation, which means the cervix starts to open. The second change is effacement. This is where the cervix thins out. The cervix starts out long and thick, but as labor nears, it thins and shortens. As your pregnancy nears its end, your healthcare provider may perform internal exams to check for dilation and effacement. Not everyone will dilate ahead of time, and that is also completely normal. Once active labor begins, the contractions will help the cervix to continue to open up and thin out. This brings us to our next sign, losing the mucus plug. The first sign you may have when you're losing your mucus plug is changes in vaginal discharge. This can include changes in the color and consistency. These can be signs that the mucus plug is loosening up. The mucus plug is a thick piece of mucus blocking the cervical opening to the uterus. It can come out in one large piece or many small pieces. It may also just appear as a blob or smear. In the few days just prior to labor, you may experience what's known as bloody show. This is thicker, pinkish discharge, and it is a sign that labor is near. If your discharge has bright red blood, you need to contact your healthcare provider immediately. Contractions are when the muscles of the uterus tighten and then relax. It can feel like your whole stomach is tightening up into a ball. Braxton Hicks contractions or practice contractions are usually the first contractions you will notice. They can occur a few weeks before labor starts. Braxton Hicks contractions are often triggered by dehydration, and drinking fluids can help them go away. Changing positions can also cause them to stop. Early labor contractions may start out feeling like menstrual cramps, stomach upset, or lower abdominal pressure. Active labor contractions will progress over time in intensity and timing, which is how you can distinguish them from Braxton Hicks contractions. The contractions will usually fall into a pattern, and the frequency of the contractions will increase over time. Contractions will last from 30 to 70 seconds and will start out 5 to 10 minutes apart. True contractions won't change no matter what position you move into. Your water breaking is one of the surest signs of labor starting. However, it only actually happens in 15% of women prior to contractions beginning. Water refers to the bags of water the baby has been growing in, which is also called amniotic fluid. When the water breaks, it can be a big gush, which is what most people expect, but just as often it will be a small trickle of fluid. Women often feel like they are peeing on themselves. If you think your water has broken, you need to contact your healthcare provider and get instructions on what to do next. There are very simple tests that can be performed to determine if your water has broken. It's important to know if this has happened because you're at increased risk of infection once your water has broken. Every woman wonders, should I call my healthcare provider if I start to experience labor signs? It's hard to say for sure. It depends on what the signs you are experiencing are and how close you are to your due date. The most important thing to remember is don't be embarrassed to call your healthcare provider. Better safe than sorry. You should always call your healthcare provider if your water breaks, especially if it looks green or brown, you see bright red blood, your baby stops moving as much or being as active, you experience any signs of labor and you are less than 37 weeks pregnant, you are having visual changes, including blurred or double vision, severe headache, or sudden swelling. These last symptoms are signs of preeclampsia, which is a life-threatening condition requiring immediate medical care. If you are worried or unsure, call your trusted healthcare provider. It's what they're there for. Knowing the signs of labor can ease your mind and stress. I hope this has explained some of the common signs of labor and when you should expect to see them. Please share your comments and let us know what topics you would like to hear more about. If you like this content, remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.